Welcome to Remix EQ Live, where we're amplifying equity with a remix of information, interviews, and inspiration. I'm your host, Dr. Erica Tate, and today I am broadcasting live from Savannah, Georgia, where I live. For those joining us today, please drop a greeting of choice in the comments. Let us know where you are joining from and the equity work that you do or aspire to do. And remember, Remix EQ Live is an experience that's meant to be shared. So I encourage you to hit the share or invite buttons and bring along your people, your network, your family, your friends, your peeps to join our Remix EQ community today. This season, we are broadcasting live on LinkedIn and YouTube, connecting more broadly, growing our reach, and continuing to build our learning community. So while those comments are flowing in and those invitations are flowing out, I want to remind you that Remix EQ Live offers the opportunity for us to connect and build community with each other around the equity-driven work being performed throughout the world. And we do this by centering the work. That is, our guests and viewers share examples of what they do in their role or position as a way to illustrate the innovative and effective ways they advance equity and the spaces in which they live, work, and play. Throughout the show and in the comments, I invite you to also share what you do to make the world a more just place. So just a reminder, this is season 4 of Remix EQ Live, and today we are broadcasting another interview show with 2 guests. Yes, it's a remix of equity-driven expertise and experiences. In this interview, in this episode, I am interviewing Dr. Kathy Anderson, a board-certified general pediatric and integrative medicine physician and founder of her clinical practice, Nurturing Wellness Pediatrics. And also joining us today is Dr. Nandi Marshall, the Associate Dean for Academic Affairs and Associate Professor at the Jiann-Ping College of Public Health at Georgia Southern University. In our conversation today, we are applying a lens of health equity as we discuss how to promote and support breastfeeding and first foods in the Black community. So I invite you to tune into this episode if your work or advocacy intersects with maternal or child health, if you apply a lens of equity to other health topics or pursue social justice in school, workplaces, and communities, or if you recently welcomed a baby into your family or are planning to do so, and of course, if you have ever been a baby. Yes, everybody should tune in because in all seriousness, when we apply an equity lens, and in this case, for this episode, a health equity lens, we are focusing and attending to the experiences, expectations, and needs of the communities we serve. To grow our work and our equity-driven knowledge and practices, we must add examples of how equity lenses are being applied in different communities. And it is just as important and informative for us to learn how these lenses of equity make visible different barriers and supports for communities as it relates to different topics, challenges, or circumstances. We can build a more nuanced understanding of the people and places we serve so that our advocacy, our direct services, and our solutions create the change that's required. So, everybody in this Remix EQ community, let us begin this conversation for change. Dr. Kathy Anderson, welcome back.
Thank you, Dr. Tate. It's great to be here, and it's great to celebrate Black Breastfeeding Week with both of you guys and everyone on.
Thank you. I invite you to introduce yourself to our community. And as you do, please share any career twists and turns that have led you to your current role.
Definitely. Well, my name is Dr. Kathy Anderson. I'm a general pediatrician and integrative medicine physician. I practice in Bismarck, North Dakota. And so my training, I guess, has been, primarily medical training. Initially, I went through undergrad and medical school at Brown University. I went on to General Pediatrics residency training at the University of Hawaii, at the Children's Hospital there and in the surrounding community. And then I went on to do integrative medicine training. And integrative medicine is the evidence-based application of complementary and alternative medicine to general medical practice. It really has great application to pediatric medicine because, as a parent and for most parents, we'd like to know what else we can do to boost our children's nutrition, to optimize outcomes for development and for learning, to optimize outcomes for growth. And integrative medicine really kind of jumps in to those questions in a way that I didn't feel Western medicine did. As far as twists and turns, I would say just based off of how I was raised and the types of medical practice and health supporting behaviors that we had in my own house, I really wanted to study integrative medicine and to learn more about more traditional modes of healing and health, health prevention, and nutrition. But figured that I should learn what everyone else was doing first here in the US before learning integrative medicine. So really the integrative lens is what I naturally see. And then having the sort of counter of the Western medicine allows me to feel like I'm able to provide holistic, comprehensive care to my families in the way that I would want to receive care, and in the way that my family members would want to receive care. And breastfeeding as a topic is really the beginning of the story. So I know we're going to delve more into that, but the twists and turns kind of were just based off of what was authentic to me about health and healing, and how I could share authentic ideas around health and healing with the patients and the families that I care for.
Thank you so much. I appreciate you sharing how you come to be. Dr. Marshall, I invite you to introduce yourself and share any career twists and turns that have led you to your current role.
Absolutely. Well, I'm happy to be here. And I do just want to pause and say that that piece about health and healing just made me feel really good. So I feel like I'm in the right place at the right time. So that's awesome. Um, as you mentioned, I'm currently the Associate Dean for Academic Affairs in the Jiann-Ping College of Public Health. And I'm also an associate professor. And most of my work really with breastfeeding is through the associate professor part. So with the associate dean part, I'm responsible for curriculum, and recruitment, retention, all things academic affairs as it relates to our degrees within the College of Public Health. And so, as the piece of the professor, though, right, I have other things, and then I have my own personal passions. My undergrad career was at Spelman College in Atlanta. I went to my MPH at East Stroudsburg University, and then actually received my doctorate from Georgia Southern. By training, I'm a health educator, so that's what got me into public health. And actually, my first love within public health really is HIV prevention in the Black community. And so that was how I started. That was why I jumped in. That's what made me change from psychology to then religion to, oh, wait, what is this? And so my father was really big on public health. I knew what public health was, but I was trying to find my own way, right? But then I read this article while I was in college about HIV in the Black community and was completely floored and was like, what can I do about this? So that's really how I jumped into public health. The health equity piece, my whole life, my whole family in one way or another worked in some sort of equity lens or social justice and health equity. And so that's just kind of ingrained in who I was as a being. I don't think I had a choice but to work in health equity. It was just how I was raised, what we know to be. But the way I got to breastfeeding, I think is really where my major twist and turn was. As I was going through my career, I focused again some HIV prevention, really got into health services researching based on some of the positions that I had. But then it was when I had my children, right? So my family, breastfeeding just is what we did. My mom breastfed, my grandma, my great grandma. So for me, I'm going to breastfeed, right? Oh, this is going to be so easy. I'll have no problem. But when I had my son, I was a grad student, I was a graduate assistant. Didn't have as many resources, still trying to find my way, and also thought breastfeeding was just something that was going to be perfect because I said I want to do it. I didn't really have an understanding of what could be the ups and downs and so on and so forth. So I went through that first experience and I nursed my son for about 4 months. So by the time we got to 4 months, I was supplementing 1 ounce of breast milk to 3 ounces of formula. And I felt like a complete failure. There were so many things. There were so many things that went into why that was or whatever. That's really not the case. The issue is how I felt and how I navigated, right? So then 6 years later, I had my daughter. And as I was pregnant with her, I said, okay, we're going to go about this a different way. So I talked to people that had information. I read more books. I did all the research. I felt more prepared. And then when there were hiccups, I knew that was supposed to happen because I knew it wasn't this perfect process. There's things, there's ebbs and flows. You look at your body. How are we doing this? How do we deal with that? But I also knew where to look for support and resources. And so also, I was a faculty member by then. I had my own office. If I needed to pump, I can close the door, right? So then after I finished through my breastfeeding process with my daughter, we got through 15 months. And after I finished with her, I really sat back, and then that was when the health equity researcher clicked in and said, wait a minute, hold on. Look at your experiences as someone as a graduate assistant and now as a professor. Look at your resources to support the knowledge and education you had. Mm-hmm. There's some major differences here. So how can we address those social determinants to make breastfeeding easier for people, or to let them know they have the support, or to provide those resources, or whatever it might be? So I think for me, that's really where those twists and turns happened, is that it was my own personal experience that made me change my focus so that I can use my education, my background, and really my passion for equity in our community and how I can make a difference in breastfeeding.
Thank you. Thank you both for sharing. On the show, we love to normalize career twists and turns. And so appreciate you guys highlighting the different pathways within health, but also sharing how your personal stories and both from childhood and as and motherhood, right, have affected, influenced the path that you're on today, which we're grateful for you being on. So thank you. And those who are watching, definitely connect with Drs. Anderson and Marshall in the comments throughout the show. We have a comment. Oh, hello, Dr. Alex Rosa, corporate wellness expert. She's saying, hey, hey. She's tuning in from Ohio. Yes, I love it. Oh, it's like powerhouse women speaking here today. I agree with you, Dr. Alex Rosa. Thank you for tuning in and keep connecting with us throughout the show. We're excited to hear from you. All right. So for those who are just joining us, this is Remix EQ Live, where we are amplifying equity through a remix of information, interviews, and inspiration. And now that you've had the chance to meet or reconnect with Drs. Kathy Anderson and Nandi A. Marshall, I know that you're inviting others to tune in. And of course, I invite you to interact with us. So please post comments to say hi, ask questions, share examples and learnings as we dive into this interview. You are part of this Remix EQ experience. So now is the time where we center the work. This is our opportunity to learn from Dr. Anderson and Dr. Marshall about how they consider and take into account health equity when they are supporting and promoting breastfeeding and first foods. So we'll start with you, Dr. Anderson, in your role as a pediatric and integrative medicine physician at Nurturing Wellness Pediatrics. How do you promote and support breastfeeding and first foods through the lens of health equity?
Well, I'm just going to take a quick step back because I don't know who all our listeners are and what they know about the benefits of breastfeeding, and just kind of review those briefly. And then maybe it'll help you understand a little bit better why Dr. Marshall and I are here trying to promote breastfeeding within our community. So there are benefits to breastfeeding for both the mom and for the baby. And then, if you think about it more broadly, there are benefits overall to the community if there are going to be benefits to that mom and to that baby. So for a baby, the benefits are that it can decrease infections, can decrease ear infections, can decrease GI infections. It decreases rates of obesity as they get older. It can decrease development of type 2 diabetes. It decreases the risk of SIDS, sudden infant death syndrome. And then it does increase opportunity for maternal child bonding. And maternal child bonding increases developmental learning, growth outcomes for baby. For the mom, breastfeeding decreases the rate of ovarian and breast cancer. It decreases the rates of type 2 diabetes. It decreases the rates of hypertension. And through the mother-child increase in bonding that can be facilitated through breastfeeding, it actually decreases the rates of postpartum depression. And then the fallout from that, if we have healthier babies, and we have healthier moms, then we have moms that are able to go to work and to contribute to their community outside of the home if they choose to. And then we have babies that are developing well, that have less need to miss school or miss other things for seeking medical care or for other needs. So back to your question, basically, of how we promote breastfeeding in our practice. And it really takes me back to what Dr. Marshall referred to as her specific challenges in breastfeeding, and thinking about sort of the understanding that our health really does depend on having good healthcare providers, but it also depends on where we live, work, and play, right? And so I'll just tell you a little story about a patient that we had. And we don't see patients in the hospital. So we're seeing patients probably at 2 to 5 days after they come home from the hospital for the first time. If this is their first baby, that may be the first time that we're getting to meet them. Anyway, we had a patient come in. The baby was about 3 days of age, and mom was breastfeeding. They were young parents. They were parents of color in the community. And we checked them. We discussed how they were doing. We answered questions, and our nurses saw them. And then I think at that visit, both my nurse practitioner and I saw them just to meet the new family. Anyway, a roundabout way, because it's a small community, it came back to us that when that young first-time dad went back to his family, he told them they were so nice to us. They were so kind. They answered our questions. They were excited for us having our baby. And so it really does, what that says to me is their experience in the hospital setting was not the experience that they had within our clinic. And so the ways that we support breastfeeding is, one, by providing education and information around the benefits of breastfeeding. Two, we hope that we are providing an open and supportive environment within which any family can feel or learn to get comfortable so that they're comfortable asking these tough questions. When it relates to breastfeeding, definitely if you've had the experience that Dr. Marshall and I had where there was breastfeeding all around and, like we saw models of it for ourselves, that's one story. That can be like either an assumption or a pressure that we have that we're going to breastfeed, which can be difficult. But if we haven't seen these examples of ways that we can feed our children around us, and we're not aware of the benefits, then it's something that's completely alien to us and a skill that we don't know and a skill that no one around us know. So we provide like specific instruction. We provide lactation visits, and along with monitoring how the child is growing, how the mom is doing, we're also helping them to succeed at breastfeeding. And then finally, it's just being accessible so that we are a constant point of access. Usually it takes 2 to 4 weeks to really get comfortable with breastfeeding. And sometimes it takes longer than that, but there are lots of points of doubt along that journey. And there are many things that can affect the success of that journey. So just being someone that you're comfortable asking questions to, that you're able to access, that we can bring in and help. And lastly, I'll just say with my first daughter, I had just completed pediatric residency. And then like 2 months later we had our first daughter, and I thought things were going okay. She was gaining weight. But I had another friend of mine and a pediatrician who was a year ahead of me recommend that I go and see a lactation consultant just to check. So I went in to see the lactation consultant. She gave me like 2 or 3 pointers, and the pain was decreased and my back didn't hurt and baby seemed calmer afterward. And I never had to see her again, but I hadn't learned that in my pediatric residency, how to address these issues. I had the benefit of the fact that baby was gaining weight okay, but I still wasn't completely confident I was doing everything correctly. So just even having someone observe and tell me that, yep, this looks like it's going well, just really boosted my confidence. And then it really provided me insight as to the small things that can be done and the training that I didn't have from residency to be able to help support mothers and their babies. And that's why I went on to get my IBCLC to help to be kind of a stronger advocate and a better support to our families.
Thank you. Thank you. I appreciate you sharing the benefits of breastfeeding and helping build our knowledge around that, but also how you frame breastfeeding as a skill that's to be learned, and that it's really important to have access to a safe space and a safe provider so that you can ask those questions and learn along the way. So I appreciate that. I'm going to turn to you, Dr. Marshall. So in your role as the Associate Dean of Academic Affairs and Associate Professor at Jiann-Ping College of Public Health, Georgia Southern University, how do you promote and support breastfeeding and first foods through the lens of community engagement and health equity?
Sure. So I've had the amazing fortune of representing our college and university on a REACH grant. So for those who don't know, REACH is Racial and Ethnic Approaches to Community Health. It's a program funded through the Centers for Disease Control and Prevention. It's a big deal, right? So all of the grants that are funded through this program are really focusing on equity solutions, or diving deeper into social determinants of health, those things that Dr. Anderson spoke on earlier about where you live, work, and play, right? So how we can look at those issues or barriers or concerns, what we can do to really address the things causing some of these issues and inequities that we see. And so as a part of this, I lead the breastfeeding continuity of care piece under the nutrition arm of the REACH grant, and we're partnered with Healthy Savannah, which is how I met Erica. But with Healthy Savannah and through this work, there are several things that we've been doing. We actually are on our 5th year, so we're finishing out the first round of our piece of the REACH grant. But one of the first things that we did is we worked on a Photovoice project. So Photovoice is one of my favorite community engagement tools. For those that don't know, it's really an opportunity to amplify voices of communities. And so we worked with some women, Black women in Chatham County, Georgia, who either had breastfed recently or were currently breastfeeding, and they took pictures, and we said, here are some things we want to know. What are your barriers to breastfeeding? Thinking from cultural, social, and physical context, what are your barriers? Like, tell us what your issues have been. And so that's what the picture piece was. So they took pictures, I talked with them, we engaged one-on-one, and then we had like a focus group around some of the things that have been happening. COVID hit. We were supposed to do it face-to-face. We ended up doing it via Zoom and had to pivot, but that's okay. But one of the best pieces about Photovoice that I love is that it's more than just taking pictures and more than just amplifying voices. It's also saying, okay, what can we do to help you? What can we do to fix this problem? We have all these resources, these people. What do you think would have helped you eliminate this barrier to make breastfeeding an easier journey, or something that you think will encourage others to breastfeed, or just what can we do to remove these barriers from breastfeeding? And so we had those conversations. We talked through those things. We had the opportunity to create this beautiful photo book that is available virtually that you can flip through. We had an opportunity to publish a manuscript through Health Promotion Practice that really talks through the process, but also talks about the barriers and the importance of listening and trusting Black women. So the article is called Trust Black Women. And so even though we highlighted the process, I also wanted to make sure to reiterate to trust Black women, because we're telling you what's wrong. We're telling you how you can help. We're telling you what resources we need. But we need people to listen and trust that we're telling you the truth so that we can do what we need to do, right? And so that others can be intentional about eliminating barriers as well. And some of those barriers, from the physical standpoint, included just a place to nurse, right? So yes, we always encourage people to breastfeed wherever you are. But if you've breastfed before, you know how quickly your child can get distracted, right? As soon as they hear something, they're looking away. They're not necessarily want to breastfeed. So one of the concerns were folks would say, hey, is there somewhere I can breastfeed my baby? And they tell them to go in the bathroom, right? Or there wouldn't be a place anywhere at all. Or if you're hot outside and there's nowhere to go. Some of the other pieces were they don't see representation of themselves. And so a lot of people don't think Black women breastfeed because all the pictures, all the pamphlets, everything you see, we see women that don't look like us. And so it doesn't feel like it's part of us. Or, some people still see it as nasty, or our breasts are overly sexualized, and so people are like, whoa, what's going on? Or they don't want you to breastfeed in front of this family member, and so then you're trying to figure out where to go if you're at a family event. There are a lot of things that we talked about within barriers and what that really means. Some of that was around social support, some of it was around cultural, and so really talking through what are some things that we can really do. Some of the pieces we talked about were increasing support systems, so increasing IBCLCs that look like us, increasing education, so having earlier education and not just waiting until someone is in their third trimester to say, hey, consider breastfeeding, go to this class. Maybe talking to people before they're even pregnant. Just like you mentioned earlier, if you've ever been a baby, we can talk about it now. Like, you might not ever want to have a child, you may not ever want to breastfeed, but your neighbor might, your faith member might, or whatever, your aunt, and you can say, hey, here's some resources for you. But it's really like a community thing. How do we support each other? How do we do all that? And then through this REACH grant also, our phase 2, we focused on the community readiness model. So we were able to talk to the moms, and now we talk to community organizations to say, hey, are you aware that this is an issue in your concern, in your community, excuse me? Are you aware of that? Do you think this is something you would support? Do you think the leadership in your community would support this? Would they put resources behind it? So we asked all types of questions, and then we were able to score the community. We gave them a community readiness number that really tells us where we are as Chatham County in addressing the need to support breastfeeding, right? And so the reason this is so important is because often we're trying to implement strategies at a point where we're not ready for them, right? So if we're really at a point where we need to increase awareness, we need to add a few things, why are we so hard and focused on trying to change this policy when you're going to have pushback if no one even knows it's an issue? And it's not saying that the policy isn't important. You can do them both at the same time. But if we're not educating people or doing all these other pieces before, it's not going to make sense. It's not going to work. It's not going to stick. You won't have the community buy-in, which is most important. When we're trying to make changes in public health and community health, community buy-in is essential. If the community does not have your back, it is not going to happen. It is not going to stick. You can yell from the mountaintop, but you need the community on your side. Like, that is important. They need to see the benefit, but you need to show them that you're actually working with them, right? And not trying to change them. So those are two different conversations. And so having the community buy-in and the support and really meeting people where they are and working through how to get to the solutions together is really the best way, and in my mind, the only way, which is why community engagement is just what I do.
Thank you. I appreciate those two examples. One, the Photovoice, a project where you are like amplifying community voice. We do love like an artifact created by community members, and especially your title, Trust Black Women. I feel like there's many things that can come just from that. Many pieces of work, Dr. Marshall. And then thank you both for sharing like the benefits and the barriers, both within like medical settings as well as within the community and the workplaces, which I think is often another way to think about community, but so often we separate it. But these workplaces are spaces that employ women and their family members, right? And so I think that like having this opportunity to consider what they can do to support women in breastfeeding is great. And on our show, we love to add examples and strategies and tools. And so I appreciate you sharing that community readiness model. And it's really a strategic way to advance health equity. And you really share that with us. So I am going to, hello, Brianna Matchett. Hello. Hashtag Black Breastfeeding Week. Excited to learn more. And I know you are. You are. I am going to kind of move us to this other part. So one of the things that I noticed when I was like both following your work as well as preparing for this interview is that both of you have leadership roles in advocacy and professional membership organizations. And I feel like these positions kind of move you beyond your day-to-day like clinical and research work and put you in spaces beyond like the workplaces and the communities that you're serving. So I'm going to go to Dr. Anderson first, and then I'll come to you, Dr. Marshall. But I'd love for you, Dr. Anderson, to share which membership or advocacy organizations you participate in and how has that participation increased your impact or your reach as you work to advance health equity for children and families?
Absolutely. There are so many stories just based off of what Dr. Marshall just said that there's so much to share. And one thing I just want to highlight from what she said is the importance of modeling and seeing yourself, especially as a Black woman living in North Dakota with 3 Black daughters. we have to be very purposeful with the images that our children are seeing, and the fact that they are able to see aunties that look like them, maybe in other places, that they see and doing different things, doing wonderful things, so that they can see themselves doing these roles as well. So that's important across the lifespan. It's important for us as we get older too. So I am very active in the American Academy of Pediatrics. I was like the president for North Dakota, and I'm currently the regional champion for the Midwest region for equity, diversity, and inclusion. And the work that we do is not centered solely on breastfeeding, although breastfeeding is one of the topics that we discussed, but it's really centered on achieving health equity in all group populations that we're serving, but specifically improving health for populations that are experiencing disparities. We're seeing that in most minoritized populations. We're seeing in Black populations and Indigenous or Native American populations as well. And the work is challenging, especially in today's political arena. But it's very important, especially if you are working in communities that you consider yourself part of and that are important to you. So we will work on different topics like asthma, breastfeeding. We will work in the Midwestern states. And so there is a lot of need for this work to be done. I mean, nationally, but here it's we have smaller numbers, I would say, that we're working toward. And so we need to make sure that the work is being done. And the partnership with a larger organization is really helpful, because then we can partner with those like Dr. Marshall that are doing more research and bring that research into the advocacy work that we're doing, and bring that into the clinical work and have it help inform the clinical work that we're doing as well. So it does help extend our reach, and the hands of many make little work. And so it does help to provide us with like solidarity in this challenging work and important work, but it also helps us to move forward more quickly.
Thank you. And then Dr. Marshall, I'd love for you to share the organizations that you are participating in and how they've advanced your impact and your reach as it relates to equity and breastfeeding and first foods.
Sure. So I think first and foremost, I'd have to mention the American Public Health Association. I've been a member since I was an MPH student and currently serve on our executive board. So APHA is really close to my heart. They get a lot of time from me, but I enjoy every minute of it. But APHA, like health equity, is really the center and forefront of everything that we do. And so we also have an engaged maternal and child health section. But APHA as a whole really is an advocacy organization. And so I am able to stay in tune through their advocacy alerts and the ways that I engage with our executive board. Like we're currently reorganizing our strategic plan, right? So I get to have input on how we're reaching health equity through our strategic plan as an organization. I'm in engaging with partners and so on and so forth. Additionally, I currently serve on the board for the Georgia Breastfeeding Coalition. And so in that role, we provide resources to folks who are across the state around policies and breastfeeding, or how to support folks who need resources. We have different recognition programs. Like there's one where we work to recognition breastfeeding friendly organizations across the state. We have a 5K that I hope to provide input on. I don't get to participate though. It's in Atlanta, and I'm close to you, Erica. So I'm in Statesboro. I'm pretty far. But again, it's another way that we get to work through advocacy to that state coalition. And then also the United States Breastfeeding Committee. So they are a larger membership organization. So something like the Georgia Breastfeeding Coalition, a lot of the breastfeeding coalitions, they belong as members. And so the USBC provides resources and support to the folks who are on the ground doing the work. And so with USBC, I'm on the crash committee. And so the crash committee really focuses on equity issues within breastfeeding. And so I have the opportunity to really help and make sure that USBC as an organization, like we're holding ourselves accountable for being inclusive, being intentional about the words we use, the resources we provide, who sits on the board, you know what I mean? Like all of those things that are integral parts of how we achieve health equity. Like everything from the ground up is important. All those upstream and downstream, looking at policy to education, right? All of those things are important. And one of the major pieces that I want to make sure we mention that all of these organizations have had an opportunity to advocate for is the PUMP Act, which was just passed in December. And the PUMP Act really looks at making sure when folks get back to work that they're able to have paid breaks to pump and to still be able to provide milk for their child, right? That's really important. And that's whether you're salaried or if you're an hourly worker. Like you have the opportunity to do that for up to a year. And something that small that someone may think is not important, trust me, it is important. And it's a way to make sure that folks are still able to commit to their nursing, lactation, breastfeeding goals that they have for their child. And that was really huge. Like that was a major win in the world of breastfeeding. I think people are probably still screaming about how excited we are about the PUMP Act. And so just having an opportunity to really stay engaged from a policy side, because all of them stay engaged and really understanding what policies are on the floor, even recommending policy actions based on what the breastfeeding community needs. And so that's been really helpful. And then for me to provide my equity background to really guide some of the work that we're doing. And so that's how I've been able to be engaged.
Yeah. Oh my gosh. Thank you so much for sharing. I mean, I think you guys are great examples and even like role models of how to kind of do the work in both places, right? You're working from the bottom up when you do your practice and your research, but you're also working to change the institutions that have policies that come down that affect how you do the work. And I think that's such a great example. And also from a career standpoint, for those who are interested in health equity work, it's not only just centering like frames that are related to equity and justice in your work, but also moving from just practicing to being a leader in those spaces that are affecting how the work gets done. And so I'm so glad that you had the opportunity to share that with us, because I think it's not something we always think about, but now that we know that it can be done and we see you doing it, then we trust Black women on this show. So we know it should be done.
Absolutely.
So thank you. Think you have a comment from, hi, Sheila Mary. Hey, welcome back. She says, love it. I love when there's exclamation points. Community education and policy. Community has to have your back. You are sharing so much wisdom on the show today. Yes, indeed. And so as we close out the show, here on the show, we expect each episode for our guests to drop knowledge and inspiration that make the world a more just place. And Dr. Kathy Anderson and Dr. Nandi Marshall, you've done just that. You've shared your career twists and turns. You've shared your leadership pathways that you continue to be on. And you really have helped us build our understanding of how to promote and support breastfeeding and first foods through the lens of health equity. So I'm going to ask you to drop one more piece of knowledge or inspiration for us. And so I'll go 60 seconds or less. I'll go Dr. Marshall, Dr. Anderson. What inspires or motivates your commitment to health equity as it relates to breastfeeding and first foods, or more broadly, maternal and child health?
Wow, that's a tall order here. I think honestly, I'll say for me, I think it's quite simple, is to honor my ancestors, honor my legacy, honor me, and honor my community, right? So my legacy through breastfeeding, that again, like I mentioned earlier, that's what we did. And breastfeeding is so powerful for all the reasons Dr. Anderson mentioned earlier and more, right? And so honoring that legacy, honoring my ancestors, which includes my dad, who I lost last year, but he was a huge champion in health equity. He is the reason why a lot of folks even use that term in public health. And for me, being able to continue his work and to honor my mom all through a social justice and health equity lens, like, to me, that means the world. And to know that I can do that within my community that has really nurtured me and grown me, I feel like this is my opportunity to give back in the way that we always do, right? We receive and we give back, and we give back and we receive. And so really honoring that feedback loop to make sure I'm doing what I need to do to make sure my community is healthy.
Thank you. Thank you. And Dr. Anderson.
And I would say for my kids and for your kids, as well as like that's where I get my inspiration from, as well as kind of validating the stories that we carry with us, what makes our experiences, our history authentic to us, and just being true to to all the knowledge that we hold within ourselves and our communities, and passing on the confidence and security of that knowledge with each other and with our children, I think is really, really important. And that's what inspires me.
Oh, yes. I'm like, you guys make me so happy. I love it, honoring ancestors, honoring the knowledge and practices that have been passed along, and then doing it for our future kids. I mean, I don't even know what else to say, but I do have a few more things to say. But thank you all so much. Thank you, Dr. Anderson. Thank you, Dr. Marshall, for accepting my invitation to speak about what matters most to you, your pursuits of maternal and child health equity. I am grateful for the opportunity to listen and learn from you, as I know the Remix EQ community has, and we especially enjoy learning why you have chosen to make the world a more just place. So thank you, and I can't wait for you to return again to engage in more conversations that push our world forward. Just a reminder, we will return on for another Remix EQ Live episode on Friday, September 8th at 11:30 a.m. Eastern. You're invited to celebrate the joy and magic of books with Joy E. Treat, who curates children's books by authors and illustrators of color, and Leslie Ann Murray, who reviews diverse books and interviews diverse writers. So tune in on LinkedIn and YouTube, and be sure to like and share our upcoming and past shows. Watch your feed, check your inbox, and visit the Remix EQ Live webpage for episode announcements, recordings, and more information about our inspiring guests like Dr. Anderson and Dr. Marshall, and of course, upcoming events. You can also watch, react, comment, and share my recent TEDx talk entitled Building Community to Make the World a More Just Place, which is inspired by the conversations and the Remix EQ Live experience. And also discover new ways to support the Remix EQ community via donation or by purchasing merch, such as our Amplify notebook. And while you're on the show's webpage, please poke around the website to learn more about my business, Blue Knowledge, and our growing family of brands and services, which advance equity in schools and communities through collaborative research, inclusive evaluation, and equity-driven professional learning. You can also follow us on LinkedIn and Blue Knowledge YouTube channel. And of course, I invite you to connect with me here in these digital streets. Thank you, Remix EQ community, for your engagement, your encouragement, and of course, your rally, which is how we recognize, appreciate, learn, love, and take care of you as you work to make the world a more just place. I'm your host, Dr. Erica Tate, and this is Remix EQ Live, and I'll see you next time.